This segment is sponsored by the Springfield Clinic. We have a special guest in the studio, a smart person, very smart doctor here. We have Dr. Swarna Rai from the Springfield Clinic. Today's topic is all about diabetes, and we're talking about diabetes because we have an awareness month that you guys kind of gloss over to help people prevent it. First of all, can you tell us what diabetes is? How can people get it?
So diabetes is a disease that can occur when the blood sugars are very high. So when you have diabetes, your body either does not make enough insulin or it cannot use its own insulin as well as it should. So the sugar accumulates in the body and it can damage the cells and it can cause serious health issues.
Yeah, and talk about some of the things that can blossom and develop if somebody doesn't treat it right away.
Yes, yes.
Yeah, do you know, I mean, how can it blossom into something worse? I mean, obviously people lose their limbs and different things like that.
The complications of diabetes include loss of vision. It can cause kidney damage, nerve damage, which can lead to amputations, and it can also increase the risk of heart attacks and stroke.
Okay. World Diabetes Day, talk about that.
So the World Diabetes Day is on the November 14th, so that's tomorrow. So it's actually the birthday of the man who co-discovered insulin in 1922.
Gotcha. Some of the tools that you guys use and offer people at home to kind of track it and make sure it's manageable, because it is a manageable disease.
It is, yes. So diabetes self-management education is one of the most important part of managing diabetes. So what patients do at home affects their blood sugars more than what the doctors, tell them every few months during their visit. So knowing how to control these factors, knowing what factors increase or lower their blood sugars, and controlling them can have a better impact on their blood sugars. So we educate patients on healthy foods, exercise, how to check their blood sugars at home, and just improve their lifestyle.
Yeah, and it starts really with a checkup and making sure that you continue to get your blood work because it can be overlooked, right?
It does, yes. So 1 in 10 Americans have diabetes. That's more than 30 million people, and 1/3 of these people don't even know that they have diabetes. There are 84 million people in the United States that are at high risk of developing diabetes. So these are the people who need to be screened for. So we spread awareness about the diabetes risk factors so that these people can get screened for the diabetes.
Dr. Rai, thank you so much. Very informative. And of course, again, it begins with a trip to the doctor and not being afraid to address these issues. So we appreciate you being here.
All right, thank you.
Thank you. Next on Good Day Illinois, a video